Hello there, Adventist retiree. Steve Thurmond here with Forward Financial. I cannot believe it's already that time of the year again. I'm a little late in getting this out to you folks, but better late than never. And we still have till Wednesday here before the annual election period starts. As you may recall, AEP, the annual election period, is the time of the year when you can make changes to your prescription drug plan, specifically through Alight. As you may recall, you have your Medicare supplemental plan with me. Most of you have a Plan F, a Plan G, or a Plan N. I am your agent of record for your supplemental plan. But as you may recall, you must maintain one product through Alight Solutions at all times in order to qualify for the church subsidy, which you get, the health reimbursement account deposit you get each and every year on January 1st. Alight is your agent of record for that Medicare Part D prescription drug plan, and you must maintain that drug plan through Alight at all times in order to get that subsidy from the church. So this is the time of the year we want to review that drug plan specifically and make sure it's still a good value. Why? Because unfortunately, these drug plans change literally every year in one or many aspects, and ignoring this fact could make the drug plan be a very poor value in the upcoming year. Each and every one of you should by now have your annual Notice of Changes booklet from your drug plan carrier. My mother is with WellCare. This is her WellCare Value Script Prescription Drug Plan Annual Notice of Changes. It's a booklet. It's on recycled paper. You open it up. You flip it to page 1 there. It says it right there in big letters. Annual Notice of Changes. An annual notice of change for 2026. Now, you may not have a WellCare Value Script drug plan. You may have a Cigna drug plan, an AARP United Healthcare drug plan, a Humana drug plan, a Blue Cross Blue Shield drug plan, and you will get a similar document from them with their branding on it. Point is that's exactly what it sounds. It's your notice of changes for your drug plan for the upcoming year, meaning that if you do nothing, you will automatically be re-enrolled into that drug plan for 2026, and you are agreeing to accept the changes that are happening to that drug plan. So there's been a lot of changes in this department, not only just the fact that these plans change every year, but in general in the Medicare space over the last few years. For one, this WellCare Value Script drug plan, as you may recall, was not available as an option through Alight in 2025, in this year. You could have gotten it in 2024, and if you liked it, you could have kept it through 2025, but it wasn't a plan you could change to in 2025. And new Adventist retirees in 2025 did not have this WellCare Value Script drug plan as an option through Alight. Why? Well, the trend over the last few years is these carriers keep cutting commissions on these drug plans. They cut us brokers, myself and Alight Solutions, out of the equation on the commission front. So most of us still do this as a service to our client because it's the right thing to do, whether or not we get paid on it. But Alight Solutions chose not to offer this as an option to retirees or its constituents in 2025 because they weren't getting paid on it. The good news is Alight is actually bringing it back in 2026. Now, this WellCare Value Script drug plan still does not pay me a commission in 2026. So I don't know if Alight has been able to negotiate special pricing. They have a lot of leverage. They deal with tens of thousands, if not hundreds of thousands of retirees, and they may have been able to negotiate some kind of compensation from WellCare directly where I cannot do that. Or they may just be taking it on the chin. There are 12 drug plans available in the Tennessee market. Now, I sell in 38 states, but a lot of you, and probably the bulk of my Adventist retiree clients, are in Tennessee. So I'm just going to talk about the Tennessee pricing and scenarios here. Anything that I say as far as figures and scenario can vary state to state, which is why it's very important for you to review your annual notice of changes if you live in any state, including Tennessee, but I'm not going to go over the figures in all 38 states that I work in. I just don't have the time, and you don't have the attention span for me to do that. So, in Tennessee, there are 12 drug plans available in the entire state. Alight will only offer you 6 of the 12 drug plans available. Again, why? My best guess is since most of the drug plans in the market don't pay a commission at all, they're definitely going to offer you the ones that do pay them a commission. And they're either taking it on the chin by offering you well care again in 2026, or they've negotiated some pricing somehow. Point being is there's 12 plans in the market to the general public, but you can only access 6 of those through Alight. And since you must maintain one product being your drug plan through Alight at all times to get the subsidy from the church, we simply pick the lowest cost option available through Alight in 2026. Now, just because it's the lowest cost available as far as premium doesn't mean it gives you the best drug coverage on your medications. So that's also something we want to take into consideration. But again, the good news is it appears they are offering that WellCare Value Script plan once again in Tennessee. So if you couldn't get it in 2025, we can move you to it in 2026. In 2025, I either moved a lot of you or put you new retirees on the Cigna Healthcare Saver RX plan through Alight because it was the lowest cost option in 2025 through Alight. It was about $27 and change. Unfortunately, there were a lot of you that had to take that option that weren't taking any medications at all. So you're literally paying $320 a year out of your pocket just to get the subsidy from the church. It was negatively impactful to your overall savings, again, because you have to pick something through Alight. They don't offer all plans in the market, so we picked the lowest cost option available to you. That Cigna Healthcare Saver RX plan that a lot of you out there have, if you've not received your annual notice of changes booklet from Cigna, which you should have by now, that plan is going away. Poof. This is part of the bane of my existence each and every year with these drug plans because they play musical chairs and pull these shenanigans each and every year. It's a giant pain for everybody involved, but we navigate this the best we can. So that Cigna Save RX plan is going away in 2026. If you do nothing, Cigna will crosswalk you, it's called crosswalk you, to their Health Spring plan, which goes from $27 a month in Tennessee up to $77 a month in Tennessee. It's ridiculously expensive, in my opinion, especially for those of you that take little to no medications. So those of you that have that Cigna Healthcare Saver RX plan, you definitely want to move to this WellCare Value Script plan in 2026 through Alight, if it's a good fit for you. That's the asterisk. We only make a move if it makes sense to make that move, but I cannot think that a $77 drug plan is going to work well for any one of you out there. Maybe some of you that have some really serious medications and you need a more robust formulary, but point is most likely a lot of you will be moving to that WellCare Value Script plan through Alight in 2026. Again, it's $3.60 in Tennessee. Some states, it's still zero premium. There are some states in 2026 where the WellCare Value Script plan is still zero premium. Again, look at your annual notice of changes, and it will tell you what that premium is in your state. Some states, this zero premium plan or cheap plan, if you had it this year, is going up to somewhere in the 40s. So it may not be a good fit for you in your particular state. But in Tennessee, it's most likely going to be the best fit for you. If you had this plan previous to 2025, if you had it in 2024 or before then, you're grandfathered in, and if your medication list has not changed, just keep the WellCare Value Script drug plan. It will automatically renew through Alight for 2026. You'll still get your subsidy, and it will still most likely be the lowest cost option available to you if your medications have not changed drastically. Now, if you've just picked up a tier 1 or a tier 2 medication there, it will most likely still be the best option for you. If you are now taking a tier 3, 4, or 5 medication, all bets are off, and we probably want to conduct a review to see if that plan is a good fit for you. In my experience, even the higher tier medications are still being covered well by this WellCare Value Script drug plan. So there's a good chance that you stay with it anyway, but we don't want to guess. You don't want to take that risk in guessing. So I'm happy to help you review. But please, please, if your medications have not changed and you are on this WellCare Value Script plan, just let it ride. Don't schedule on my calendar. I try to help as many people as I can during this time of the year. My calendar will fill up within a few days of you folks seeing this video. I cannot get to everybody, unfortunately. But if you have no major changes to your medications and you have this low cost plan, just let it ride, okay? Don't schedule on my calendar and eat up time that somebody else that really might need the help and guidance. Let them get on my calendar so I can help them. So I love speaking with each and every one of you when you call. I do, but again, I have to really be efficient with my time during this annual election period window because I try to help as many people as I can with this scenario. And keep in mind, I'm doing Alight's job for them in this scenario, but I provide it as a service to retirees on an annual basis because it's the right thing to do. So yes, just to recap, if you have the Cigna Saver Healthcare RX plan, it is ballooning in Tennessee to $77. It can be various prices in other states, but the plan is going away because they're going to crosswalk you to a HealthSpring plan. HealthSpring was a carrier 10 years ago in the Middle Tennessee market in the Southeast. Cigna purchased them. It was about 10 years ago that Cigna purchased them and rebranded everything as Cigna. For whatever reason, I have no idea why, they are now pivoting and going back to HealthSpring for their drug plans and Medicare Advantage plans. To my knowledge, there is no change whatsoever to the Cigna supplemental plan. If you have a Cigna supplemental plan, which a lot of you do, there's no branding or name change there as far as I know. You would have been sent notification otherwise. But they are changing all of their drug plans and their managed care plans, also known as Medicare Advantage plans, to HealthSpring. I think it's a dumb move. Cigna is a much bigger, more recognizable brand, but who knows? Whatever. They can do whatever they want, and they often do on an annual basis, much to my dismay. Let's go over some figures, Medicare figures. I'm going to just see if I can't share my screen here really quick. Let's pull this up here. I'm going to share the 2026 Medicare figures. So for 2026, there are changes. If you're not aware, Social Security is giving you, I believe, a 2.9% cost of living adjustment. Medicare is going up significantly on their Part B premiums and deductibles. So your monthly premium for Medicare Part B this year, 2025, was $185. It is increasing 11.6% to $206.50 per month for your Medicare Part B premium. That is, again, a projected amount. None of these figures are set in stone yet, so CMS, the Center for Medicare and Medicaid Services, can change these figures before the end of the year, but they will be announced officially at some point between now and the new year. At least historically, they always have been. Annual deductible this year was $257. If you had a Plan G or a Plan N supplemental plan, remember those two plans do not cover the Medicare Part B deductible and you were responsible in calendar year 2025 for the initial deductible, Part B deductible of $257. That is going up, projected to go up 11.2% to $288. So once again, in 2026, you will get a bill in the mail up to but not exceeding $288 for any services rendered. And that's the key phrase. If you don't go to the doctor, you're not going to pay a deductible. The vast majority of you do at least go to the doctor once a year, so most likely you'll hit that deductible at some point in calendar year 2026. You will get a bill in the mail up to but not exceeding $288. That can come in the form of one bill for $288 from wherever you got services rendered, or several small bills from multiple doctors that you may have gotten services rendered, but it should not exceed 288. Keep track of that figure throughout the year, if you would, just so there's no discrepancy there. You do not want to overpay a penny more than that $288 projected in 2026 for your Medicare Part B deductible. Once the Part B deductible is met, your Plan G, your Plan N kicks in and covers the other 20% for the rest of the year completely. Between original Medicare A and B and your supplemental Plan G or N, you've got 100% coverage. If you have a Plan F, as you may recall, that's the old Cadillac coverage, that covers the Part B deductible completely. And you do not have to pay that Part B deductible at all because the Plan F covers it. So the Part B deductible only applies to Plan G and Plan N. There are some other plans, older plans out there as well that may pertain to. But for the vast majority of you that are seeing this, you have a Plan G or a Plan N. And so that deductible applies. If you do have a Plan F, most likely you are overpaying. Now, some of you cannot pass underwriting guidelines and cannot leave your Plan F and get a better value Plan G or a Plan N because your health is in a way that an insurance carrier simply won't accept you in an underwriting guideline scenario. However, if you live in a birthday rule or anniversary rule state, of which there are 17 in the union, you can move from your overpriced Plan F to a Plan G or a Plan N for better value and savings, and certainly call me. Now, the vast majority of you that are seeing this are already my client, and I've already counseled you on all of this, but if you're passing this video along to somebody else, this might be some good information for them. So those are the Medicare Part B premiums next year. Remember, you may recall there is a Part A deductible, but all of the supplemental plans cover it completely, so that's not your responsibility, so we don't even need to discuss that Part A hospital deductible, because Plan F covers it, Plan G covers it, and Plan N covers it, so it's a moot point in that regard. Yes, Social Security cost of living adjustment, 2.9%. Now remember that's a cost of living adjustment on your Social Security check. So that 2.9% should at least eat up these Medicare Part B premium and deductible increases for the most part. I've not done the full math on that yet, but yes, it's a lower cost of living adjustment with Social Security, but it's on a higher figure. So it should eat up most of that, these increases for Medicare. Uncle Sam giveth, and he very quickly taketh away, as the saying goes. So in all, it may just be a wash at the end of the day, but at least if we're keeping up with that, it's better than not. So yes. So scheduling, let's just talk about really quick here. Most of you that are seeing this are going to hop on my calendar. And you've got a email there. You've got an email with this video link in it. The bottom of my email in big letters, it says, click here to schedule an appointment. That goes straight to my calendar. Please schedule some time with me if you want to conduct a review. If you want to conduct a review. Keep in mind, again, this time of the year, October 15 to December 7, only pertains to your drug plan. It has no bearing whatsoever on your Medicare supplemental plan. As you may recall, you can change your Medicare supplemental plan at any time of the year for any reason, as long as you are healthy and can pass underwriting guidelines. That's the kicker. At least here in Tennessee, that's the kicker. In other states, there are 17 states in the union, which again have a have a birthday or anniversary rule or rolling open enrollment provision. If you live in one of those states, you get notices from your supplemental plan, and I've probably told you about that provision. So, of course, we can always review making a supplemental plan change per those birthday and anniversary rules to maximize savings if it makes sense to do so. But if you live in Tennessee, we don't have that provision, and you'll have to pass underwriting guidelines, and that can vary from carrier to carrier, nuance to nuance. If you think you may pass and you think you're overpaying for your supplemental plan, you can call me at any time. We don't have to wait till this window of time. We can change your plan at any time of the year as long as you're healthy and can pass underwriting guidelines. So don't hesitate to reach out. Most of you, I do this on an ongoing basis. Weekly, I'm moving clients from one plan to a better price plan. So I may have already taken care of this for a lot of you, but point is, hop on my calendar if you have questions. That's what I'm here for. And if you can be mindful about your drug plan and your drug plan needs, please leave this time of the year for those individuals that really need some help in navigating drug plan changes. If you have a Cigna Saver RX plan, I think it's Cigna Healthcare Saver RX plan, it's going away, and if you do nothing, they're going to crosswalk you to a very expensive plan. So we definitely want to make a change through Alight for you. If you're comfortable with doing this on your own, if you are internet savvy, if you can log into your Alight account and make the change, please do so. Please do so. Because if not, I have to do it. And again, that's taking away from somebody else that I might be able to help a little bit better that needs a little more hand-holding. But if you're capable of doing it, please do so. It's not that hard. The Alight account is fairly intuitive, actually. And if you're taking little to no medications or they're low tier, just enroll into that WellCare Value Script plan available through Alight for best savings next year. What else here? So, but if you need help, hop on my calendar. The bottom signature of my email there, it says click here to schedule an appointment. It goes right to my calendar. You can also go here to my website, forwardfi.com, right there. Just type in forwardfi.com. Once you get here to my website, you'll see my logo, phone number. Right here, this little hamburger stack menu. Click on that, and it says right here, schedule an appointment. Just click on that. It opens up my calendar, and then you can choose some time. If you think it's a quick scenario where we just need to quickly move you to a drug plan, schedule a 30-minute meeting. If it's an hour, but you're a couple, and again, you think it's going to be quick, yeah, an hour should be fine. Only the more involved scenarios, if you have multiple medications, and some of these are high-tier medications, schedule the 2-hour meetings. So if you don't need the 2-hour meeting, stick with 1 hour, and generally speaking, we should be able to knock everything out for you, even if you're a couple within an hour. But we have to be mindful of the time there. So, yeah, that's it in a nutshell. Good to hear from you. On a personal note, we're doing well at home. Our girls are growing up way too fast. We have a 6 and 8-year-old now, going on 15 and 16, it seems. But we're just hanging on for dear life and rolling with the punches, but having a lot of fun in the process, watching them grow up. So keep in mind, I do all walks of insurance, income, and retirement planning. There's several of you out there that I, myself and my colleagues have helped with some income and retirement planning. As I have discussed with many of you before, most of you have a 403B with Empower. And not only in my assessment, but my colleagues' assessment, that is a subpar performing retirement plan that you have. On average, it's getting around 2% or less in earnings on an ongoing basis. And we absolutely have much superior options to that for income going forward. So if you would like to discuss that, please wait till after this Medicare Madness window here and schedule something with me in the new year if you want to discuss some income and retirement planning options. Long-term care, we can have helped some clients with that as well. If that's something you have not discussed with your spouse and your kids, it's something you should be discussing. Common misconception is that Medicare covers long-term care scenarios. It does not, folks. If you need care, whether it's memory care or assisted living facility care, nursing home care, or if you want care in your home because you cannot perform at least 2 activities of the 6 activities of daily living, that's going to cost money. And if you don't have a long-term care plan in place, I can certainly help you explore some of those options as well. I will usually rope in one of my colleagues who are experts in these fields, whether it's a properly structured annuity or a long-term care product, and we can discuss your options. Present you with a solution or a couple of options for you to consider. No pressure there, but your 403B with Empower is subpar, and that's just a fact, unfortunately. And so if you want to look at other options, happy to help you explore those options. Anything else here that I can think off the top of my head? I'm trying to recall. It's late in the day, and it's I'm trying to bring on some staff this next year and grow and to better help and accommodate my business and growth. So you may, if you do call, those calls may be routed to one of my staff members, just because I'm here in front of this screen for sometimes 10, 12 hours a day during the annual election period here. But so yes, if you hear any new voices when you call, it's still Forward Financial. We're still here. And don't be alarmed. We'll try to handle your calls and get them routed properly as quickly and efficiently as possible. While I do love seeing you for in-office appointments, and it really is a treat for me, I enjoyed the in-office appointments. I would ask that you do not schedule in-office appointments during this time of the year, simply because those in-office appointments take usually 2 to 2.5 times longer than they would if we're just having a quick phone call or a Zoom call. I really have to be mindful with my time and maximize my efficiency to help as many people as I can during this very busy last quarter. So if you would, please don't schedule in-office appointments. Schedule a Zoom call or a phone call, preferably, and we can that way help as many people as possible during this busy time. In the new year, come in and see me. Come spend a couple of hours. We'll catch up and enjoy some face-to-face. But during this time of the year, I would ask, please, that just schedule a Zoom or phone appointment. If you simply must see me in person, then I'm not going to turn you away. My door is always open. So it's just a polite request there. What else? I'm not even sure what to cover. I'm kind of already I would want to say burnt by now, but because the floodgates haven't even opened yet. But it's going to be a very busy annual election period season for me, so I'm bracing for impact, as I always do this time of the year. So, but yes, I look forward to speaking with each and every one of you. Hop on the calendar, come with your questions. Please come prepared when you call. Please have a list of your medications, especially if they have changed. For a lot of you, I already have your medications plugged into Medicare.gov, or we have them listed on your Alight drug list. If those meds have changed, please take the time to make sure your drug list is current and accurate. What I need from you to be most efficient, I need the name of the medication, the milligram amount you're taking, and how often you take it. It kills a lot of time when we're sitting there on the phone and you're having to run around the house to collect bottles. So please get that information together before our appointment. And that way you can just rattle it off, or I can rattle them off to you and you can confirm whether or not the list is accurate and needs to be updated. Um, Other than that, I think we are pretty good to go here for the annual election period again, October 15th to December 7th. Oh, as I always propose to you folks, a lot of you still have the sharp dental, vision, and hearing coverage. As I've said many times before, it's good coverage. I'm not disparaging the coverage. I just don't think it's a good value. That coverage is costing you $214 a month as a couple, $107 a month each as individuals. Um, and the trend continues to go up. It seems every couple of years they raise it by a couple of bucks or so. Again, it's good coverage. It's just not a good value. In my opinion, there are better value options available in the market. And if you want to explore moving away from Sharp, we can do so. You have until December 10th. Now, annual election period to change your drugs is October 15 to December 7, but the North American Division, Adventist Risk Management, and Sharp gives you till December 10th to leave the Sharp dental, vision, and hearing coverage if you so choose. No pressure, but if you want to explore some savings, typically I'm able to save a couple that has the Sharp DVH over $1,000 in premium annually by moving away from Sharp. Not always, it varies by the product we move you to and where you live and your age. These are all factors, but on average, I can save right around a grand, if not more, in premium annually by leaving Sharp, and that is by replacing it with another option that's a better value. I like Cigna in most markets. Some of you have had issues with the Cigna plan I moved you on. But in my experience, those of you that have had issues are going to out-of-network dentists. Cigna is a PPO plan, but it still has a PPO network. And if you go outside of the PPO network, you pay out-of-network pricing. So it's important that you stay in the PPO network to maximize value. As you may recall, Sharp doesn't have a network at all. There is no Sharp DVH network. So every dentist you go to with Sharp, technically speaking, you are paying out of network pricing. And so, at least as an apples to apples comparison there, you're going to get much better value with a network-based plan. And we would only move you to that network-based plan if you are going to a dentist that's part of the network, because that's how you maximize the value. There are some other options out there as well, which we can explore if you would like. I think that's about it as far as that information. I've rattled on long enough here, and hopefully you've gotten some value out of this. Don't hesitate to pass this along to anyone that you deem necessary. A lot of you ask if I'm still accepting clients. Yes, absolutely. I'm trying to grow, in fact, to accommodate more, bringing on staff, agents, etc. It's going to be a process, but yes, no need to ask me at all. Just send people to my calendar if you want. You can go to stevethurmond.com. That goes to my electronic business card, which has a link to my calendar. You can go to forwardfi.com and click on schedule an appointment. You can pass along one of my emails that has that click here to schedule an appointment button right below my signature. Point is, no need to ask. Just feel free to send people my way, pass along my number, send them to my calendar. You don't need to ask. Yes, I am accepting new clients all the time, and I welcome them. Referrals are the lifeblood of my business. They are very much appreciated. I've gotten countless referrals from many of you out there, and I very, very, very much appreciate those referrals. So absolutely keep them coming. No need to ask. I am licensed in 38 states, coast to coast. And if you have a friend or a family member or somebody that needs help in a state I'm not licensed, I can very quickly pick up my non-resident license there and help and accommodate. So don't even hesitate to ask. Just pass along the number. I used to help you folks. I used to have some partners for property and casualty, home and auto. We are all, myself included, experiencing the pain of raising home and auto premiums. in the market, and everybody's experiencing that pain. So I no longer have an option in multiple states like I used to have. My partner in that regard, their outfit was acquired. It was Dickinson Insurance out of Idaho Falls. They were acquired by a bigger conglomerate, swallowed them up, and cut off the partnership that I had with them, unfortunately. I can still help you, though, or I have a partner here, a colleague that I refer business to in Tennessee, Georgia, Alabama. So if you're in the regional area here in the Southeast, I can pass along that information if you would like a quote on your home and auto, and I'm happy to do so. So don't hesitate to reach out in that regard. Um, yeah, I think that's it for now. Of course, if you got questions, don't hesitate to ask. Again, please uh, be mindful of the calendar situation and scheduling on my calendar, and leave some room for individuals that may need some more hand holding. In short, if you have the WellCare Value Script plan, and it's worked well for you in 2025, it should continue to work well for you in 2026. So do nothing, just let it automatically renew. If you have the Cigna Healthcare Saver RX plan that I put you on through Alight in 2025, we want to move you either to the WellCare plan or another option through Alight that's going to be a better value. Really, there's only two there's two WellCare plans. One is in Tennessee, one is $3.60, the WellCare Value Script plan, and the other is the WellCare Classic plan, and it's $3.70, 10 cents difference in Tennessee. They have different formularies, though, and so most likely I'll be moving a lot of you to one of those two plans, which is great because it's going to actually be a savings compared to what you were paying this year. And it will certainly be a savings compared to what that Cigna plan is changing into in 2026. So you definitely want to make a move there. If you can make that move on your own, please do so. If you cannot, that's what I'm here for, and I'm happy to help you do so. With that, I hope each and every one of you are doing fantastic. I hope you have a wonderful holiday season. Halloween is approaching. That's my daughter's favorite holiday because they're all about dress up. It seems like Halloween every day of the week in my house. But really looking forward to Thanksgiving, which is my favorite holiday, and Christmas coming up soon as well. So if we don't speak, have a wonderful holiday season. Don't hesitate to reach out to me at any time. Please continue sending me referrals. Please call me and use me as a resource for anything insurance, finance, income, retirement planning, cryptocurrency education. I'm a big advocate of decentralized peer-to-peer electronic cash systems and crypto. So if you're curious about that, some of you and I have talked about that at length, and I can talk your ear off in that regard. So point is, use me as a resource. If I can't help you directly with any of the above, I can typically point you in that right direction that you're looking for. So don't hesitate to use me as a resource. Have a wonderful rest of your year if I don't talk to you, and I look forward to seeing a lot of you on my calendar here very soon in the upcoming weeks and months as the year closes. Take care, folks, and we will talk soon. Bye-bye.